Good morning, colleagues. Today I would like to do a procedure which we call removal of a Jadelle implant, or just removal of implants, because there are several implants that we have around. So here I'm with Mr. Chibuye, the one who's going to remove the implant. So guys, this is Mr. Coco. Remember to subscribe or like the video. So let's look at the setup which we have here. So on the trolley, what we have, this is a povidone which we're going to use, and then that's the suture. Okay. Then after we remove the implant, we're going to.
Depending on the size of the incision we're going to make, it attracts that we can use a suture to just close the incision. So,
Okay.
but if it's going to be a small one, then be it. You can simply dress it and close it as usual.
Okay.
Then there we've got some instruments. Of course, we are not going to use all of these instruments. They are sterile, of course. We are only interested in using 2 of these curved artery forceps. Out of all these, we are only interested in 2 of these. And in case we may need to suture, we may use the needle holding forceps.
Okay.
For holding the suture that we've opened already, in case we would need to use it.
Okay.
Also, as usual, the dissecting forceps, we may need to cut the edges as we are approximating the 2 ends during the suturing process. So first things first, I'm going to make sure I put a drape under my patient there.
Okay.
Also to protect my linen there. Of course, we have already palpated the site. This was the insertion site. We've palpated, and we can actually feel the rods, the presence of the rods. They are here.
Okay.
So first things first, we set everything. I have to put on the sterile gloves. We clean the site. After cleaning the site, we have to infiltrate the site with lignocaine so that we induce the local anesthesia. Until we are convinced that anesthesia has been achieved by way of asking the patient, she's going to give me the feedback. Then thereafter, we have to start the procedure by making an incision. Then we start locating the rods. So first things first, I have to clean the site using my antiseptic solution, that is lignocaine.
So the site is being cleaned.
I've identified it. Started with the central part, then I'm going around like in circular motion. You see?
Okay. So the site has been cleaned.
Yes.
Okay.
Once I can also use the clean one.
Okay.
Just to dry the site. Going on to burn my sterile gloves. Remember the technique for wearing the sterile gloves? The before of the steps that I go through burning the sterile gloves. So
Okay.
sterile gloves.
So that's lignocaine.
There I go. I've identified the site there. Then I go like first direct at the site where it was inserted. Aspirate as usual, since this is lignocaine. Infiltrate a bit, then go on the sides. Because remember, we had implanted this using the V approach. Same entry point or introduction point, but you direct them in a V shape. Aspirate. As I'm coming out, infiltrating. Change direction. To follow the other direction for the second rod. Aspirate. Infiltrate. Keep coming out. Okay, just here again. Since this is where I'm going to make an incision, you also have to make sure to infiltrate quite enough some lignocaine.
So colleagues, lignocaine has been infiltrated so that the patient should not feel any pain.
Yeah, sure.
Yes. Okay.
So we have to palpate a bit to facilitate the absorption of a local anesthetic agent that is lignocaine to the center.
Okay.
After palpation, 30 seconds or a minute or so, I'm going to start to test if it has been effective by way of asking my client.
Okay.
Can you tell the difference between here and here? You can tell. Here and here you can tell. So here you feel pain, here you feel like I'm touching.
Yes,
Also,
yes.
yes.
So meaning the local
So it's
anesthetic
happened-
drug has worked, right?
Yes. So it's happened since after palpation I had identified that this should be an approximate point of entry. So I'll make an incision.
So an incision is being made there
Yes.
at the site of insertion.
Yes. It's right here. That's that.
Okay.
I'll start
Then now,
dissecting.
okay.
I'm going to be deep dissecting on both directions. Before I even attempt to start moving, I will try to dissect. Sometimes these rods, they tend to adhere to some tissues or some muscles inside.
Okay.
So I'm trying to doing some maneuvers to make sure they get detached from the whatever tissues they have been adhering to. At this point in time, it's always important to interact with the patient to find out if she's in pain, so that you establish the effectiveness of the introduced anesthetic agent.
Are you feeling any pain? Okay, the client is saying that she's not feeling any pain. Okay.
The local anesthetic agent has worked.
So initially we had to ask for permission from the client so that the procedure can be done. So we just started on the other part where we started straight into the procedure. But the initial things that we do, like asking for permission, were already done. So consent was already obtained. As you can see, the implant is
we can identify the tip of the implant. So no wonder you have to use the two artery forceps. Since I've identified one end, I will try my best to capture that.
Okay. So that's identification of the part, the implant. Yes. So as you can see, the implant has been hooked up.
So I'm trying to separate it from the adhesions. I'm trying to separate adhesions. It's attached to the tissues down there.
Okay, so that's the implant. There you go.
First rod.
Yeah.
It's always important to show it to the client.
Okay. So that's the first rod that has been removed.
So we'll start now attempting to locate the second one. So this went this direction. Now we have to go the other direction, because remember we had mentioned, you say the technique for insertion, you have to be put in V shape.
Okay. So Mr. Chibuye, what implant was inserted?
This one is the level plant.
Okay.
Level plant it works the same way as Jadelle, except the period of effectiveness. With Jadelle, remember, it's two rods, just like this one, but it remains effective for 5 years. Now, level plant is two rods, just like Jadelle, but it remains effective for 3 years.
Okay.
Sure.
So those are the differences that we have?
Yes, the differences, yes. Otherwise, the components are one and the same.
Okay.
Mode of action, one and the same. And in most cases, the side effects that one would experience when on Jadelle or when on a level plant are almost the same, because they contain the same hormone.
Okay.
Sure.
So that's identification of the second rod?
Yes. Trying to maneuver around. So in palpate here, you feel for it. You also direct your forceps towards where you are able to palpate the. If you are in pain, let us know so that we add some more local anesthetic if you need to.
Has it been hooked up?
Not yet.
Okay.
It's trying to identify some tissue. At times you may be misled, because when it gets tender,
Yes.
it will appear like that's just the rod, and they just
Putting
hooking the tissues.
The tissues. Okay. So one implant has been removed, so waiting for the second one to be hooked up and removed.
So we're trying to use what we call approach, blind approach.
Okay.
Yeah, you palpate, you maneuver, you palpate, you maneuver. Of course, taking precautions not to go deeper, because remember there is a brachial artery here.
Okay.
Yeah, so if you go deeper, you may temper with the
Brachial artery.
Yes.
Okay. So that's a precaution.
Yes, a precaution.
Don't go deeper.
Yes, don't
Okay.
go deeper. And basically, these are supposed to be inserted subdermal, just under the skin, superficially.
Okay.
Yes. But at times, many are the instances where you find, even after you implant them superficially, you find that by the time you'll be removing them, they tend to like a little bit go deeper.
Okay.
And we've had the cases where you cannot basically palpate for them, you can't feel them at all. Then when you subject them to the X-ray, the X-ray is able to detect them. These are X-ray detectable.
Okay.
When you subject the client, once they report to the hospital, you find that the rods are missing. You subject them to the X-ray, the X-ray will be able to pick them.
Okay.
Then in most cases, such cases we take them to theater, that's where we move them. Because they will need sufficient anesthesia
Okay.
to actually have them removed, as opposed to this simple local infiltration.
Okay.
So we have to make a big incision, go inside until we locate them. Some we find them embedded inside the muscles.
Wow, they really go. They really travel.
Yes. So if you feel something, let me know. I'm trying to locate.
So this really takes special skills. At
Yes,
least you have to be trained.
Right. Sure.
Yes.
You have to be trained. Yes.
You have to be trained so that you're able to identify them, you're able to insert, you're able to
Right.
remove.
Yes.
So this is something that you have to be trained.
Sure.
So at the end of every procedure,
Yes.
as usual, you need to thank the client, you need to
Very
communicate,
important.
and
Very important.
yes, and also try to find out how the client is feeling because there is anesthesia involved.
Yes. Now, depending on an individual's pain threshold, others will say no need for painkiller, others will say maybe I may need some painkillers. So basically, just prescribe it. Just ordinary paracetamol.
Okay. So paracetamol is enough. Okay. Okay, so the second rod was embedded in the tissues. It went deeper. Yes.
Trying to turn over. No, we are still trying to manage, I think.
So as you can hear, the client is concerned if the other road is being located. Yeah, so psychologically you need to start giving psychological care to the client because the client is worried.
Yeah,
Looking at the time.
Yes. Just taken for us to look at the second one.
Yes. So those are some of the effects of these implants.
Implanted, yes.
Yeah,
they can implanted. Yes. Times when it's time for removal, these are some of the challenges that we usually face.
Okay.
And the other thing, you realize that before removing on palpation, you simply see them. But once if you treat lignocaine, that infiltration tends to like promote the not visibility location of the rods. It's like once you infiltrate some lignocaine, the area become like swollen because of the infiltrated. And when you start palpating for them, you have some challenges, like they are missing.
Okay.
Sure. They are in there and they are holding it. So where I feel pain in Germany. So it's important that you make sure that the patient is not in pain. The client is not in pain at all costs. Ensuring the comfort of the patient.
Okay.
So usually it's up to 2-3-5 minutes is done. When you are easily able to locate them, 2-3-5 minutes the procedure is done. Shouldn't take you as long. So these are some of the challenges that we face.
So that's the location.
Yes.
The other implant.
Yes.
Is trying to. So they're hooking up. So it's slipping off. That's why it's taking long.
Please communicate when there's too much pain, so after you inflict some more okay? Just 1 minute like this. I'm expecting this to find the area on the one like this.
Yes.
So our area of operation is just this area.
Okay.
So I didn't just anywhere around this. Yes. Since it was in this shape.
Okay, so that's the incision. Then you're supposed to follow the V, but then when the second rod is lost, you need to search for it. You need to really ensure that you locate it. And then you have to also ensure that you infiltrate some more lignocaine because the patient is experiencing some pain there. So this is how the rod looks like. The one which has been removed. Okay, so after removal, this is how it will look like, and the patient was shown this rod. Okay, so you need to locate for the second one and remove it. So that's the job that you have. So this is what we call removal of implants. So you can still see this as well as practice or get trained in this program so that you can be able to remove the implants or insert the implants. So this is just a setup in terms of the example that we're trying to show you. Okay. So at the moment we're going to at least discontinue the video, but at least you've seen the way we remove it. Yeah, the way the first part has been done, and then the second part will be removed as soon as possible. So thank you very much, and keep training and keep watching.